at hypertension as a chronic disease, diabetes as a chronic disease. And so because of that, we've only been focusing on that. And the problem with that is we are failing in, and when you look at the adequacy of control, it's not adequate. So go back to the basics, go to the molecular level. And we realized one of the things that is in common is obesity. So if you don't tackle that, then you end up with the complications and you make physicians very rich. So when we look at the epidemiology, what we were saying by the end of 2022 is 1 in 8, if we were to count in every table, likely in as much as you look slim, probably have an element of obesity. When we come closer and we're looking at the rising burden across Africa, you can be able to see that when it comes to both overweight and obesity, women are actually leading. This is the one time we ask women, please do not lead the men. We actually need to change this graph. And you can see that we're looking at prevalences as high as 9%. This is so that you can be able to then tackle it. What is interesting, and when you look at it, when we looked further in Kenya, is we found that surprisingly, even in those remote areas like Kajiado, it was as high as 50%. So why is it that we would say it's an urban problem, but we're still finding it in the rural setup? And I think it is just literally people mimicking what we think is amazing and exciting. And now because they're mimicking the diets, the lifestyles, we're ending up with complications like the diabetes, the heart failure, the stroke. That's why we're making Dr. Joa very happy here, and quite a number of patients are coming with metabolic associated liver disease. We're having quite a bit of osteoarthritis and cancer. So this is what I want you to focus on. One, in as much as you're targeting up to 20% of your weight loss, you want to preserve your lean mass, and that enhances then cardiovascular protection. And how are you going to achieve that? Diet, exercise, but not just exercise. It's the same way you'll not just tell them, or just go and watch what you eat. The nutritionist is actually going to tell you how we are going to ensure you have a high protein, low carb diet to enhance or reduce the insulin resistance. Number 2, when we talk about physical exercise, we're talking about focusing on resistance exercise, and that also enhances insulin sensitivity. Then you go to your pharmacotherapy. And when all else fails, then you can consider bariatric surgery. However, there are patients who ideally should come here. And so you would want diet, exercise, and then if you're, according to EASO certain indications, if your BMI is more than 40 or more than 35 but you already have some obesity related complications, or your BMI is more than 30, poorly controlled diabetes, probably on more than 3 to 4 agents, and now are starting to develop complications, these are the people you'd want to consider surgery. So you ensure that first they have seen your nutritionist, your exercise specialist first, before you subject them to that. But there are people who are actually afraid of surgery. Not everyone wants to go under the, actually I don't think anyone wants to go under the knife. But if you tell them the benefits, then it's very important. However, if you actually want to see if this is a patient who will handle the diet post-bariatric surgery, some of these patients we actually subject them to the GLP or dual GLP-GIP analogs, and then if they're able to sustain, then they're candidates for bariatric surgery because you know they'll be able to maintain the diets thereafter. So even as we talk about that here and there are certain things that we need to think about. We live in a highly obesogenic environment, isn't it? Ultra-processed foods and all. So it would really be good to hear what we are doing in Australia, actually out there in South Africa, and I'm glad that ISIM has come. How are you influencing policy? Okay, how are you trying to be able to prevent this to be a generational curse? One of the things we suggest is, let's look back. It's a problem that began somewhere, right? These obese adults did not just wake up one day and was suddenly noticed to be obese. I got an 18-year-old in the clinic yesterday and we're discussing with the nutritionist and weighs 128 kgs. Where were the pediatricians? I mean, you were monitoring this child, right? They were coming for vaccines from the time this child was born, and then you put the child in this obesogenic environment. So one of the things is, let's target our children. So one of the things you'd focus on with the youth is, what are you doing in the schools? You have to make sure that they actually have playgrounds. How much time do they actually have for physical activity? So one of the rules in Kenya is you can't build a school if you don't have a playground. Do you know that? Number 2, do we actually have walkways? You know, one of the things we had proposed when we were in the integrated society, when we're dealing with Ministry of Health, is we talk to the Department of Roads and we say, please ensure that there are walkways beside the main highway so that you encourage people